Welcome to today's podcast of Academia Libera Mentis. I would like to talk about data today, and I'll use it using measles in the US. Measles, both cases and death. And I have this graph coming from our World in Data, which is a source that's leveraged data, US data from the Center of Disease Control in the American census. It's historical data from 1921 to 2015, so over time. And here is when children start to become vaccinated in the US. If you look, the blue line are measles cases, and the red line are measles death. So looking at this graph, both the cases and the death go down. So initial, you think vaccination really helped in reducing cases as well as death. Now I want to go a little bit more into the detail of this graph. What do we actually see? Because this is just a scale from 1921 to 2015. But what does this mean? Look at the scale. It's not just a linear scale, so 1, 2, 3, 4, 5. No, it's 100, 10, 1, 0.1, 0.01, 0.001. What does that mean? It's a logarithmic scale. So what it means is it's not evenly distributed. And this is very handy if you have two graphs in different order of magnitude. So you can now have both the deaths and the cases in the one graph. You can see a bit more detail. So it goes not kind of linear here. It goes 10, 20, 30, and then the higher numbers are very close together. So it's not evenly spread, these numbers between 10 and 100. What can we see for the measles cases? So these are cases. The annual rate of new cases and death per 100,000 people in the population. And that's just to have it a little bit easier, because over time the American population has increased, and so now you can compare apples with apples. What can we see for the cases? So it's above 100, and it's going up and down a little bit, but it's kind of constant until the early 1960s when they started vaccination. And then it goes down. It goes up and down a bit, but measles is a kind of a fluctuating disease. It's a children's disease, and you sometimes have waves of more measles. It goes down. Here is a little bit of, looks like a measles outbreak, and it goes down and goes up a bit, but it's going zigzagging a bit. The reported deaths does kind of the same, also kind of reasonably stable. It goes down a little bit, and then it goes down much further with a small outbreak, and it's down. Wow, it works. Now we need to actually look at the data, because that's really important. Not just look at the graph, say, yeah, it goes down, it's all fine. So this is historic data. If we look at this part, here, all the other parts we have each year adopt. Here, between 1920 and 1925 to 1940, we have no measurements. How come? Why don't we have measurements? We had deaths that year. We didn't have cases. This kind of indicates most likely that they're from two different data sources. So measles deaths could be from death certificates where the cause of death needs to be described. Since it's a children's disease, and most often children are dying from measles, it would most likely be on the death certificate. Measles cases is differently reported. It might be a nurse or a doctor writing it in some sort of database. And they might not have kept up that database during that time, but they might have the death certificate. Then, on the other hand, they didn't have any reported deaths between 1940, almost 1950, while they had the cases. So there might have been something with the death register. So this indicates two different data sources. So always be aware of it. How reliable are the data sources? That's one thing. Then we look at, if we look at the cases, so we start 200 to 600. What is this? So if we take the line, roughly 0.1 case per 100,000. What does 0.1 case per 100,000? Pretty low. But for deaths, we have 0.001. Now you have to think, imagine there are no one who have died of measles in a year. What do you do with a scale like this? Because it never goes to zero. So every step, it just adds a zero behind the dot. What do? They add one case of death to all the numbers. So regardless of whether it's 0 cases or 1,000 cases, you add one, and then you make the graphs. And then, so this very low number might be a zero, rather than 1 case per, or 0.001 death per 100,000. So really be aware of what that means. So this looks a little bit like a downward trend, and then goes further down that way. So there is already a little bit, it's not a linear trend. This looks straight and going down. So coming back to, did vaccination reduce deaths? There was already a downward trend from 10 cases or to less than 1 case per 100,000. So what does that mean? We know with measles that good public health, so good sanitation, good food, good nutrition really makes a child more robust and less likely to get secondary infections like pneumonia, which is generally the cause of death. So it's secondary to the measles, you get the pneumonia or bronchitis, which might kill a baby. And with better hygiene, just food, sanitation, that has really improved the survival if you get measles. So you see that downward trend, which goes a little bit further. So yes, it still goes a bit further, but we're still talking about a log scale. But do we really think it works? Well, so as it's resulting in cases and death, cases probably, yeah, I would say yes. Death, probable. But now, same graph, same data, but look, this is a linear scale. So it's 0, 100, 200, 300, 400, 500, 600. Again, the blue thing is the reported cases. The red line are the reported measles deaths. Okay, the cases go between 200 and 600 before vaccination, and then you see a steep drop, and there are hardly any cases. You remember that peak around here in the previous slide? That's hardly anything because it was a very low scale. So cases, yeah, that goes down. But what about deaths? How many people actually died in 1921 of measles? This is per 100,000. Hardly anyone. Do you think anyone has died of measles in the US? Well, probably here, a couple. But for the rest, it looks like 0. So they added that 1 on that scale. Based on this, what will be the answer on has vaccination in the US resulted in a reduction in measles cases? I would say yes. The measles cases have gone down. Measles death? I think the answer would be no. So always be very wary. What are the scales on a graph, especially the y-axis? Is it really starting at 0? Is it going? Is it linear? Is it log scale? What are we really looking at? Because same data, very different impression of what the data might show. If we then go to a last little graph. So these are 2 graphs where we know in the US the number of people, the population has increased. And in addition, measles is only a disease for kids from 0 to 5 years old. So the previous graph was for the whole population in the US. Is that a good measurement? We rather want to know whether kids are dying or are having cases of measles. So this is expressed before vaccination. The number of measles, the percentage of the 0 to 5-year-olds having measles in 1 year in 1920, 1940, and 1960. And the blue is the cases, and the red is deaths. Well, there are no deaths. It's hardly any percentage. And there is like a 3 to 4% each year have measles beforehand. So hardly any kids died at that time. And if you look at the right-hand side, so within epidemiology, you often hear how many people should be vaccinated before we prevent 1 case or death. That's and then you look before vaccination started. And if you look at here, for 38 kids to be vaccinated, you prevent 1 case of measles. But 1960, to prevent 1 death of measles, you would have to vaccinate 35,000 kids. And imagine also the side effects, etc. So a lot of kids need to be vaccinated to prevent deaths. So whenever people talk about measles vaccination really prevented measles death, these data don't suggest that that would be the case. Thank you so much for listening today, and I hope you found this interesting.